Sage is targeting us because we have been successful for a long period of time. We have been successful in calling attention to some of the dangers that are associated with uh, abortion and specifically chemical abortion. Uh, for a long time, there were no investigators who were doing independent science. And so pro abortion investigators, uh, these are pro abortion investigators that um, publish in journals that are virulently pro abortion, which are most of the journals. Uh, they were making the case. They were making the case that abortion is safe. It was for them, it was fixed science. And some of our work, especially some of the work on emergency room visits, had represents a, if you will, a different point of view than the narrative that they thought was secured. We asked a simple question: when women have an induced abortion, what is their likelihood to visit an emergency room within the next 30 days? And we wanted to compare chemical versus surgical abortions. And what we found is that for any kind of an abortion, there is an increasing likelihood that they're going to end up in the emergency room within uh, 30 days, and that chemical abortions are significantly more likely than surgical abortions uh, to result in a visit to the ER. It demonstrates that some women go to the emergency room after they've had a chemical abortion, after they've had any kind of abortion, with experienced bleeding, and they do not communicate to the emergency room physician that they had the abortion. So, or maybe they do communicate it, but the emergency room physician doesn't note it in the record. For whatever reason, it's miscoded, so that those women are not usually identified. We're never identified in any other study. We put numbers on the size of that population of women who are miscoded, and then we further demonstrated that if they are miscoded, they're treated differently than if they were properly coded, and they're much more likely to come back into the hospital to be admitted for removal of the products of conception. In other words, to complete the abortion. This these findings have been used in legal actions in many of the states. We have become visible. People are quoting us, and for that reason, we are dangerous. And for that reason, they want to cancel our work. What happened to us has little or nothing to do with real science, and has everything to do with political assassination of real science.